COVID hit us on so many levels.
We were hit very hard.
It was not easy to understand in the beginning.
There was a lot of fear and there was a lot of misinformation.
So a lot of people dying.
Everything shut down.
The Partnering for Vaccine Equity program was created to increase education, access, and acceptance of vaccines. Early on in the pandemic, it was quite clear that COVID did not impact everyone equally. So when vaccines did become available, we wanted to ensure that communities that were most in need, migrant, refugee, people with disabilities, minority populations, had the information and the access.
When we started this project, we had about a 12% vaccination rate among our residents. We recruited about 25 of our residents who became vaccine ambassadors, went through an extensive training that covered vaccines in general, COVID, flu, myths.
They call me the mayor because I know everybody's business, and I know what's going on.
The majority of our tenants are Black and brown folks who haven't had positive experiences with healthcare, positive experiences with government institutions.
My job was to go around to doors, giving people the information. We gave out flyers. We did tabling also.
The issues in Cuyama are often getting the information out. Most of the people work in agriculture. They're spread out over a large area, primarily Spanish-speaking.
And it's very hard for the members in this community to trust outsiders. The promotoras are the key person to go and connect them, knocking on doors and passing the flyers. They trust the promotoras. Also for the vaccines, if you can register electronically, the internet here is not the best. A lot of the communities, they don't have a device to register either. When again, the ladies go out there, they have a sign-in sheet, and we got people registered. On that day, 48 people got vaccinated.
The first time that the vaccine became available, it wasn't easily accessible. When you spoke to a representative and explained to them that you were a person with a disability, they didn't really seem knowledgeable about how to help you. It was a lot of hoops that I had to jump through to get that first one. When I got the shot through Able, South Carolina, it was so different. They came up with a lot of strategies to run a barrier-free vaccine clinic because they never done it before. I felt at ease because it was just so welcoming. Everyone was friendly. You know, it's just refreshing.
In our first 2 years of the program, the number of people that we've been able to reach directly, yes, it was extraordinarily successful.
Our vaccine ambassadors were so successful that in less than 6 months, they more than quadrupled our vaccination rates.
I'm very grateful for all the work that Able SC has done.
Just that satisfaction of serving my community, it's 100% worth it.
We're in the process of renewing our agreements with our partners to move into the third year and ensuring that we're maintaining and building those relationships. We're very excited.